Good afternoon. Welcome everyone, and thank you for joining us for today's webinar, facilitated by Hunter New England Central Coast Primary Health Network and being presented by Hunter New England Local Health District's Diabetes Alliance team. Today's webinar will be discussing Hunter New England's Diabetes Alliance Urgent Care Service. So my name is Charles Broadfoot and I'm one of the Professional Development Officers with the PHN. I would firstly like to acknowledge the First Peoples and all the traditional custodians of the lands, of all the lands that we're meeting on this afternoon. And I'd like to pay my respects to elders past, present, and those who are emerging. Today's session is being recorded and the recording will become available in our PHN education library on our website. So to access the recording, you just head to our homepage, thepHN.com.au, and click on the Education tab. There will be a short evaluation survey that will automatically pop up when the webinar ends. If you could just take a moment to fill that out before you log off, we always really appreciate your feedback. You can type in questions in your questions box in your control panel at any stage throughout the presentation today, but please know we have allocated some time after the main talks to go through these questions with you. So it's now my pleasure to introduce Morag Joseph. Morag is the Diabetes Alliance Program Manager, and Morag will introduce the rest of the team. So thanks everyone for joining us, and I'll hand over to you, Morag.
Thank you, Charles, and good afternoon, everyone. Thanks for your time. I hope you're eating a lunch and having a seat while we provide some information, and that will give you great support to both you and your patients in general practice. Many of you here today have been watching back have been involved in the Diabetes Alliance either via case conferencing in your practices or in education sessions, in masterclasses or nurse education. Urgent care is a pandemic response model to run over the next 3 months. Many of you know me over the years and I've been privileged to work with you and alongside you. Thanks for your continued support. I'd like to introduce you to the team who are really extremely excited to be rolling out this model. We've been working together as a relatively new team and we're excited to work together and bring this to you. And we're really keen for you to ask questions, which we'll go through at the end of this webinar. So Michelle Chris sitting next to me, albeit from another room, is the Service Manager for Diabetes, and many of you may have worked with her in the Alliance as a diabetes educator. Tamara Whitworth up there is our Diabetes Alliance diabetes educator and who worked on the phone number which we're going to share with you very soon and received the very first of our calls yesterday, which was very exciting and which had many hundreds of photographs taken by Michelle Chris when she was taking our first phone calls yesterday. And working alongside me, and which is great to work and sharing my role as a program manager, is Sarah Pullen, who is going to be fielding our questions today and answering a lot of them. I'd also like to share Kelsey Rolfe and Deb Wilgansky, who are not on the video just now, but who are listening to the webinar as part of our PHN partnership, as part of the Diabetes Alliance and working in primary care improvement, particularly in diabetes. They work as part of our alliance supporting across the region, and they are your go-to with MBS and also particularly with e-referral support if you're having any difficulties, them and the greater team. So please contact them if you need any further support in those areas. Some of you are here from practices that might have Diabetes Alliance bookings for later in the year. Don't fret, we're still really keen to keep those bookings and we will be talking to you over the coming weeks. And however, if you do have patients that need to access urgent care in the interim, please do so. And as you listen further into the webinar, you'll understand how that's going to work. So this model is a pandemic response after direction from health leadership to transition clinical care to virtual care wherever possible. This encompasses the whole of district across the Hunter New England using My Virtual Care, which is a really easy application to use. You don't need to download any application to your computer or your telephone or another application. You simply click on a link, or your patients click on a link if they're part of the program, and you're in the clinic. We have details on health pathways under diabetes referrals, and a referral can be found under the Diabetes Alliance urgent care referral, but this will be given to you by the diabetes educator who is manning the phones. We also have a listing for GP referral liaison, who is now Tamara Whitworth, who has a bio in Health Pathways. And we need you to get this mobile number amongst your clinicians. If you're a practice manager listening today, please get this number amongst your clinicians, doctors and nurses, get it on your PCs, get it on the whiteboard, and please share this number around. I'd like to hand the next spiel over to my colleague Michelle, and we're really excited to be sharing this with you. Thank you. Michelle, you're mute.
Okay, hello everyone. Sorry about that. I pressed mute on a different button, it seems. Thank you for joining us. And look, the phone number is 0436 276 161. That's most important, and I want you to put it up on your whiteboards. And I hope you can see the urgent care flyer with the beautiful photo of Tamara on there on your screens now. So I'm really excited to discuss the urgent care model with you all. And after this session, as we said before, we want you to have this number everywhere so you can see it, so you can access it, so you can actually ring it. And it's not just for the doctors, it's for practice nurses as well. So it's any diabetes related issues. No issue is too small, no issue is too big. We're happy to get a phone call from you. And the team that's actually manning the phone, they're really experienced, and they're completely supported by our diabetes specialists. And the advice that you will receive from these people, it's all evidence-based and it's all directed by Health Pathways. So it's not just our opinion about diabetes, it's actually evidence-based, and it's the real deal. So we know that diabetes is very complicated, and we know that over the last 12 months with COVID, our patients with diabetes, they haven't been accessing health services the way that they normally do. They're not going there on a regular basis anymore. And there's been a few people with diabetes that have been slipping through the cracks. So now what you guys are seeing out there is that the patients that are coming back to you, we're finding that the severity and the progression of their disease complications is way more serious. So the urgent care model is going to give you access to a senior credentialed diabetes educator. They're going to take the call and they're going to guide you to a solution that's going to best manage the patient in the circumstance and prevent further decompensation. They can also escalate treatment and, if required, get an urgent appointment with a specialist through My Virtual Care with the GP, plus or minus the patient. So that's amazing. Like, we can actually, if we triage the patient and we feel that they need an urgent appointment, it can almost be within the week that we actually get the patient along with a GP into the My Virtual Call with the diabetes specialist. So that's amazing. Ultimately, we want to prevent the patient from decompensating further, and we don't want them to present to hospital. So, by ringing this number, we're going to make sure that that doesn't happen to your patients. Tamara's going to talk to you a little bit more about the flow and how this is actually going to look. But a perfect example was yesterday, the first call that I took, like 7 photos of Tamara answering the phone. We received a call. It was regarding a patient that had been in the GP practice previously, months earlier, with a HbA1c of 5%. They hadn't been to the GP practice for quite some time, but when they returned yesterday, the HbA1c was significantly elevated now, over 8%. So Tamara was able to streamline a process and get that patient booked in to see a diabetes specialist Friday this week for a case conference with the GP and with the patient. So it's going to be invaluable, and I want you to feel confident and comfortable to ring us. As I said before, no issue is too small, no issue is too big. We're happy to take the calls, and we really want you to be confident to do it. And we're waiting to hear from you. We're really keen to hear from you. So write down the number. It's 0436 276 161. And I'm going to hand you over to our Tamara now. Thank you, everybody, and thank you for signing in today.
Awesome. Thanks, guys. And thanks, Michelle. You just want to turn your video off, Michelle, so it's all me. So I'm just going to run you through a little bit, like Michelle said, the flow, so you know what to expect when you call. And I do want to reiterate what Michelle said. We're a friendly bunch. As you can see, we're a bit quirky and a bit fun. So we're really happy to take any calls, and don't be shy to call us, and we can definitely direct you in the right direction. So it's myself and another colleague at this point that will be answering the phone, and we've worked within the service, but we've also worked within general practice, and we know the restraints that you guys have, unfortunately, particularly during this pandemic time. So what we want you to do is to ring that number. I feel a little bit like a salesperson, or like I'm trying to get your votes for The Voice, but 0436 276 161. That's the number you need to ring. If you forget and you ring switch at John Hunter, that has now been transferred across to that number. So if you do contact John Hunter looking for some diabetes advice, or the diabetes doctor on call within the Monday to Friday 8:30 to 4, you will be redirected to that mobile number regardless. So there's three main arms, I guess, that I'm going to be considering when you guys ring. And obviously I'm going to be getting a bit of a history from you. So if you have that information available in terms of medications, their duration of diabetes, type of diabetes, that's always great. The more info, the better. And the main three arms, the first one is advice only. And that's obviously the easiest one. There's a range of things that I might suggest. It might be sick day advice because your patient's got gastro and they're not sure what to do with their insulin doses. It might be that they're type 1 and their pump has failed, and they've presented to you or contacted you and they don't know what to do in terms of getting a replacement pump or returning to MDI injections. We also get regular phone calls about pre-op advice, fasting for surgeries and procedures and what to do around their medications there. You might have a patient like the one yesterday that's got an increasing HbA1c, and I can give you some advice around the escalation of oral medications or even the starting of insulin. So like Michelle said, we're very evidence-based advice. We get a lot of our information from the RAC GP guidelines, which you guys are all familiar with, but you guys do so many different health conditions. Diabetes is our specialty. We can, name the page number that you need to turn to. So that's really helpful. If you just want to ring us, we can tell you, page 136, start basal insulin. Looking at their weight, I'd suggest this dose. That's stuff that we can do as specialized CDEs. So please don't feel like, oh, I'm just ringing a nurse and I'm really not going to get a lot of advice. You definitely will be. I might also suggest, engaging a diabetes educator or a dietitian, and that can be obviously in-house, private world, or you can refer to us. And I might be able to redirect your call to somewhere more appropriate. So for example, if you're ringing up about someone that is pregnant, that's a specialty group that we're not going to be providing specific advice on, but we've got the right contact numbers of where to redirect you, whether it's a Maitland patient, a John Hunter, whether you're rural, etc., etc. So we're kind of like a one-stop shop in the advice field, I guess. The next thing that we're happy to offer is a titration service, and we've had lots of interest from GPs in the past for this service, and so that's why we've added it to this urgent care model. So basically, if you ring up and you've got a patient already on insulin, but their sugars, aren't where you'd like them to be or in their sugar range of goal, we can forward you our titration form, which we get you to complete, as well as a referral. The referral we prefer is the electronic or sent referral, but we do understand if you're not using the sent referrals, we do have an urgent care paper one that we can forward to you. You select Diabetes Alliance Urgent Care as the drop-down menu, and that basically gets forwarded back to us, and then we will contact that patient 3 times across 3 weeks, and we can increase their insulin or decrease their insulin as required to achieve their target sugar levels. So it takes that sort of workload off you guys. You can be confident and comfortable that they're being managed and kept in touch. At the end of those 3 weeks, if their sugars are where we would like them or close to, we'll send you a discharge letter back saying this is our advice, see them for a 6-monthly annual cycle. Or it might be we want you to book them in and see them, and they may need a bit more insulin titration, and this is what we would suggest. Or if it comes to the end of the 3 weeks and we're still concerned and they're significantly out of range or they're having hypos, we would escalate that to a My Virtual Care case conference with yourself and preferably the patient, but if not, the endo and the GP and the diabetes educator. So on the titration form that you receive from us, there's a little tick box where you consent that if at the end of the 3 weeks the sugars aren't where we would like to be and they're significantly out of range or of a concern, that you consent to a My Virtual Care case conference being arranged. That just stops us having to ring you and get consent. So it's really important if you can try and tick that box and you're happy to really tick it, because then we can contact your practice directly, arrange what we need to arrange, and it really makes it more efficient. As Michelle was saying, we're having urgent care, My Virtual Care case conferences every week at this stage. So we really can get you in quite quickly, which is amazing. All those wait lists and previous having to wait to see a specialist is kind of taken away. And that's where this, virtual world now with COVID has been a real bonus. You will receive a discharge letter from us with their current doses, and that we always advise the patient to return to you guys and just discuss where you're up to. The third option is if I triage and go, yep, this person definitely needs to speak to a specialist, and this week within an urgent care My Virtual Care case conference, we can arrange that straight away. We would prefer, and we understand that you guys are busy and you're booked up well in advance. So we like to discuss the time and the date and the clinic there and then on the phone and book you in, saving phone calls and arrangements back and forth. So for example, with calls yesterday, I was able to book in 6 people on Friday, just over the phone with the person that rang through, and they've all been booked in for times that suit you guys. And I think that's a bit difficult in GP land because you are so time poor, but we understand that, so we can kind of work around you guys to keep it very efficient, provide the information that you need, but not take too much of your time up. So just remember, with the My Virtual Case Conference, it's the endocrinologist, the GP and the diabetes educator from our end, plus or minus your practice nurse, and we would love them to join in because it's still a great learning option, and particularly with the Alliance, and that's a lot of their sort of background is wanting to upskill the GPs and the nurses. So next time you have a similar case, you're not required to ring, you'll know exactly what to do. So if the practice nurse is available, that's always great. And then the patient is optional. Once again, it's always great if the patient is engaged and wants to be there, but if there's someone that's not able to access technology, or you think it'd be better to talk about them without them there, we can do that, and then you can organise a follow-up with the patient to discuss what was arranged and discussed in the appointment, I guess. So the 3 main arms are advice only, and that will be talking on the phone and then handed back to you guys. The titration the titration arm does require a referral, preferably electronic, and we will forward you the appropriate titration form. And if you need advice on, how much to increase the insulin by and filling out that form, we can talk you through it. It's very simple and it's something we're very familiar with. They get 3 phone calls across 3 weeks, and then we send you a discharge letter back. If we're worried about them, we can escalate it to a My Virtual Care, particularly if you've signed and ticked that consent box. If you forget and you don't, that's fine. It just means we'll contact you and arrange it. And then the third option, once again, is the My Virtual Care case conference, where you have the specialist, yourself, and the diabetes educator, plus or minus the practice nurse, plus or minus the patient. And so from that case conference, there's a range of outcomes. It might be recommended medication changes. It might be recommended pathology or other screening testing. We might recommend a private or coming into the public diabetes education or dietitian review. We might actually get you to refer to our usual endocrinologist clinic, and they'll be added into the wait list for a follow-up appointment. But the real aim here is about upskilling you guys, GPs and practice nurses and the patient, so that we can discharge back to you. We don't want to take them on. We want to skill you guys up and just instill you with confidence around, you know, what's required for that patient. At the end of the My Virtual Care case conference, the endocrinologist notes will be faxed to you that day, or if not the next day. So you've got a bit of a plan and some notes to add to your notes in terms of legality and things. They are billable. So the MBS numbers for a case conference are a 735, 739 and a 743, and these are time dependent, very similar to your health assessments, etc. And these sometimes are subject to change, but at the moment these are the numbers that we've been utilising. So basically there is a financial benefit as well as educational, and as well as for the health promotion of the patient from these case conferences. Awesome. So that's just, you know, briefly the flow. There's a whole background and process in the background, as you can imagine, like everything. But yeah, please feel confident to call us. We're very specialised. We want to basically give you more time to get on with things and not have to go searching and delving. And we would love to hear from you. So yeah, I'm going to say that number one more time: 0436 276 161. Vote for me, or give me a call, and I hope to talk to you soon. I'm just going to hand over to Sarah now, and everyone's going to pop back on for the panel to answer any questions that have hopefully come through. There they all are. Awesome.
Hi everyone, thank you so much for that rundown, Tamara. We do have a few questions on the board, so I'll just run through a few of those, and just please do send through any additional questions as we go. So the first question is, will the triaging happen on the spot, or do we get a call back regarding the outcome? So this model is aimed to be as stress-free as possible. So when you contact the diabetes educator on that phone number, the triaging will happen on the spot, and you'll be directed whether which arm you will go to, whether it's advice only, or if you need to send a referral through for insulin titration, or for specialist support. So the triage will happen on the spot, and you'll be notified of which arm that patient care will go down at that time, at that initial phone call. And then if extra documents such as the titration form are required, that diabetes educator will forward those documents and talk you through that process. The next question is, how long will this service be offered for? This is a pandemic response, so we're using the existing resources of our Diabetes Alliance program that unfortunately aren't being used as best as we can through the COVID pandemic. So this service will run at this stage for 3 months' time to help with the load GPs have upon them at the moment with the pandemic response. Do we have an example of a titration form and where we tick the box for consent? So the titration form is something that we use within GNS Diabetes Services, and is always used by our diabetes specialist endocrinologist at John Hunter. So it's not publicly available at this stage, but when your patient is identified as needing that service, that form will be sent through to you, and the diabetes educator will walk through that form with you and help you to complete it if needed. It's a very simple form asking for the doses of insulin that the patient's already taking, and an agreement will be the escalation, I guess, of insulin titration across that 3-week period. So the insulin dose might be titrated by 1 unit per week, 2 units per week, 4 units, whatever the needs of that patient are, and whatever the particular insulin regime is and type of insulin considered. A comment in there says this is a very exciting service, and we're really, really happy and excited to bring it to you as well. Really hoping that we can provide some good support to all of you doing great work out in the community there. Will it be the same endo for case conferences? So Our Diabetes Alliance roster uses a few of our different endocrinologists, and they may change week to week depending on what their rosters are. And just in mind, our diabetes specialists are still working within the acute system as well, so it will be a roster of different endocrinologists taking care of this service. And just an additional point there, at the moment we are running a My Virtual Care clinic weekly. And at each clinic, we do have 10 appointments available within that clinic that stretches across that whole day. And we're potentially seeing how the service uptake goes, could add in an additional clinic with our resources as needed over the coming weeks and months. Are our brochures available online? I think Charles will be able to answer that one a little bit better.
Charles,
I think they are.
Yeah, Charles is going to be emailing all the participants this flyer, and so yes, they will be. And they'll be on the Diabetes Alliance website attached to the PHN. So yes.
Excellent. Another question, if the patient has seen a particular endocrinologist in the past, can we request the same endocrinologist based on availability? It would be great in the referral for you to know that that patient has seen a particular endocrinologist, and we will absolutely try our best to put that patient in contact with that specialist again. But again, it will be pending rostering and needs of the acute care services as well. This is a one-off clinic appointment, so if further follow-up is needed after that initial My Virtual Care appointment, there may be need for an outpatient appointment again in our usual service where that patient could potentially pick up with their endocrinologist that they've previously seen. Just another question.
I'm just going to add there, sorry, Sarah. During the phone call of triage process, I will have the endocrinologist that's doing the upcoming My Virtual Cares listed, so I can have that conversation with the nurse or the GP around, you know, the urgency. And so it might be, okay, you know, it's not urgent for this week, but the endocrinologist that you're requesting is doing one in 3 weeks. Let's add them to them. So it's definitely up for negotiation, but it's not going to be a routine, available to their specific endos.
Yeah, thank you, Tamara. Another question is, how do we decide whether a patient is provided advice listed for titration or goes for specialist advice? So this is, our triage is based on the referral criteria listed in health pathways. So patients most listed as most urgent or urgent criteria as per the health pathways guidelines will be prioritised, and the particular needs of each patient will inform that triage process and help us to decide which path they take. However, as we've mentioned, we're happy to talk about all patients with diabetes, and every consultation will be on a needs basis of both the patient and the GP service as well. So I think that's, oh sorry, I've got one more question coming in. I have postponed our Diabetes Alliance clinic, but I feel a particular patient should be seen or discussed earlier. Should I still include them in the Diabetes Alliance clinic later in the year, still if they have been seen as part of this service? That, again, will be a needs basis conversation. So please do give us a call and we can discuss the urgency and what the follow-up process will be, pending where that patient is sitting with their healthcare at the moment. Okay, so thank you so much again for your time today, and we hope that you've found this quite valuable. Please ring us. The phone number is 0436 276 161, and we are up and running and ready to take your calls. So I'll hand back to you, Charles. Thank you.
Thanks so much, Sarah. Thank you everyone for sending in those questions. Fantastic questions, and this is why we have these forums, and we always encourage you to ask questions because I'm sure there's many of you that are thinking the same thing. So yeah, please always enter your questions. That was some great discussion. I just want to take this opportunity to thank Morag, Michelle, Sarah and Tamara for taking the time out of your busy schedules to present the service. Yeah, we really appreciate it. So just a reminder that the session is being recorded. So if you do have colleagues that maybe missed it or couldn't attend live today, it will become available in our education library within the next 24 hours. And as Morag mentioned, this flyer, the service flyer, I will also send that out to everyone. So you'll have a copy of that as well. And just lastly, a friendly reminder, if you could please complete the evaluation survey. It'll automatically pop up when the webinar ends. We always really value your feedback and we're always looking to improve how we can deliver education to you. So thanks again to the Diabetes Alliance team and thank you everyone for joining us and we hope you enjoy the rest of your afternoon. Bye-bye.
Thank you. Bye.